Welcome. On behalf of the Faith in Action Project, we are excited that you can join us for this important and timely conversation, supporting youth in crisis and addressing mental health and housing instability. The Faith in Action Project serves as a catalyst to educate and empower faith and community leaders to implement lasting solutions for people confronting poverty. And we're so excited today to learn more tools and strategies about how we can support our younger generation. To moderate this conversation, I'd like to introduce Professor Nicole Robertson. Dr. Robertson has had over 5 years of serving as a licensed mental health therapist, and she has worked diligently in both the nonprofit sector and private practice arena as the Director of Counseling and Therapy. Dr. Robertson, thank you for sharing your time with us today and for leading this important conversation.
Good afternoon, and thank you, Lindsay, as well for this opportunity to be able to share with our community related to this critical issue as it relates to our youth and their issues as it relates to mental health and housing stability. So today, as we begin our conversation, we'll be discussing this timely issue and these critical concerns. And as we begin, I'd like to share with you all some statistics and information regarding the mental health and housing concerns of our youth. Mental Health of America in 2022 reported that across the United States, over 2.5 million, individuals, approximately 10.6% of our youth are dealing with major depression. That rate is higher for individuals who find themselves identifying with more than one race. Additionally, 60% of our youth are dealing with symptoms of major depression and cannot receive mental health treatment. That translates to 1 in 3 young people going without their mental health concerns being treated. Here in Indiana, to bring it locally, 30% of our youth have mental, emotional, developmental, or behavioral concerns. That's 5% greater than the national rate. For children who need support from a mental health care provider, approximately 49% experience difficulty accessing care. And 7.2% of those children do not obtain care at all. The assumption is that our school counselors would fulfill the mental health care provider gap for youth. However, that counselor to student ratio here in Indiana is 694 to 1. A significant capacity issue based on the recommendation from the American School Counselor Association, which recommends a counselor to student ratio of 250 to 1. So we see that we're at a loss. Our school counselors are almost 3 times at capacity than what is recommended by their national organization. Additionally, regarding housing concerns, Eviction Lab reports that since December of 2022 in Indiana, eviction statistics have been at a rate of filings of 73,894, up from a 1% average as related to the pre-pandemic years. This means that 1 in 10 households here in Indiana will receive an eviction filing. And within those households of 1 to 10, it is a great possibility that youth accompany or occupy these residents and accompany their parents, guardians, and caregivers with these particular eviction filings and notices. Therefore, consequently, leaving them at risk for housing instability. Here with us today to discuss these critical matters are Kelly Coker from Bright Lane Learning, Ashlyn Dalfit from Reach for Youth, and Joseph Myers from IYG. Welcome to you all. For our audience today, I would like to invite you to share a quick summary about your respective organizations, their mission, and how they serve youth facing mental health challenges, housing instability, food insecurity, and or other poverty-related issues. Kelly, would you like to start this conversation?
I'm happy to. Thank you so much to everyone who's here as well. My name is Kelly Coker. I'm the Chief Operating and Program Officer with Bright Lane Learning. And we work to transform lives of students impacted by homelessness and housing instability with personalized tutoring and academic support. At the same time, we also advocate for families as they're navigating the education system. And so we work very closely with families who are experiencing housing instability, and the intersection of housing instability and mental health issues is extremely high. So the majority of our students, all of our students are impacted by trauma, but we also see that high prevalence that you mentioned, Dr. Robertson, of mental health issues within that population as well.
Thank you, Kelly. Ashlyn?
Thank you, Dr. Robertson. I'm glad to be here with you all today. My name is Ashlyn Douthit. I am the Supervisor of Mental Health and Clinical Services at Reach for Youth. Reach for Youth is a nonprofit mental health agency providing life-changing services through mental health, restorative justice, and prevention services. So we provide a wide variety of services to youth ages 7 to 17 and their families. I would encourage you all to visit our website at reachforyouth.org to learn more specifics about all the varieties of programs that we offer.
Thank you, Kelly. Thank you, Ashlyn. Joseph?
Hey everybody, my name is Joseph Myers. I have recently been promoted to the Director of Mental Health Therapy at IYG. And so IYG is a organization, the longest continually operating queer youth center in the country. We've been operating since 1987, and our mission is to ensure that all youth in Indiana are within an hour's drive of a safer space in the state. And so we work with queer and BIPOC youth, folks who are experiencing homelessness, or marginalized populations, to provide free services, so mental health therapy, food pantry, clothing closet, housing support, all of those things, all free of charge for our clientele. And we work with youth ages 12 to 24.
Great. Thank you, Joseph. Thank you all for sharing this information with us. And I'm sure our audience will look for more information on your respective websites. But I know that because of our time, folks are very interested in hearing more about this topic. So let's get into some of our questions. Kelly, this question for you. The data reveals that students are struggling with mental health issues and concerns. How do you think it affects students' ability to succeed in school?
That's a great question. And I think the short answer is greatly. I think that when we look at mental health, we all understand that mental health affects the whole person. And so when we look at our students who are impacted by mental health issues, it's in affecting their ability and mindset to learn. It impacts the results of the work that they are actually able to complete, their ability to build positive relationships, and all of these things just compound on each other, really affecting the academic success of our students. And I think we talked about the different populations of students that all of us work with on this call, and those are students who are all also impacted by trauma. And so it's another compounding factor when we look at their academic success. And I think what we see, I mean, a lot of studies have talked about kind of the reciprocal relationship between mental health and academic success. So mental health can lead to poor academic success, but also poor academic success can further contribute to the mental health issues that our students are seeing. And so it really does take a lot of support to come around a student with mental health to kind of encourage that academic success. And when we look at students who are most impacted by this, it's the community groups that all of us talked about when we first introduced our organization. So students experiencing homelessness and food insecurity, our LGBTQ youth, our English language learners, students with disability, and students of color are most impacted by those mental health issues and that the academic success challenges. So when we look at all of that, the struggle we're faced with is we can't just teach, or we can't, for us as an organization, we can't just tutor. There has to be a supportive community in those educational environments to help our students succeed. And one of the things I always say is we've tasked schools with a much bigger job than teaching our students. But to your point in your initial stats, we haven't resourced them to do those things. And so, it just continues to impact our students as they look for that academic success. We know that 50% of almost 50% of our high school students are impacted by stress, anxiety, depression. All of those things are impacting their ability to learn. And so we are just in a different time post COVID too, where that number has significantly increased. And so we have to look at how we can come around these students as a community to kind of support that academic growth.
Thank you so much, Kelly, for that. I think one of the things that was resounding in the conversation was this need for a supportive community and a supportive environment so that our youth can find resources for the help that they need in order to be able to be successful in school. And I think that gives us a wonderful segue to one of the questions that we have for you, Joseph, as it relates to the supportive community environment and community involvement. What does it look like to be a safe or a safer place for our youth in a supportive environment? And could you share with us as well, or would you share with us as well, some of the best practices related to that type of supportive environment or safer place?
Yeah, absolutely. Thank you for the question. I think so a lot of times we talk about safe spaces. That is a language that we use. And we want this to be a safe space. We want this to be a safe space for all people involved, but that doesn't always answer the full call of what a safe space means. A lot of times when we talk about safe spaces, we think that's going to be the end all be all space, but we talk about safer spaces now with the acknowledgement that we are making the space as safe as possible while acknowledging that there is potential for things to be wrong. There's potential for harm to be done unintentionally. There's potential for things to not be perfect. And so we strive at IYG, and going to push our other organizations to do the same for safer spaces, where it's like we're acknowledging that we are doing the work to be a safe space, but we have more work to do. And there will always be more work to do. As a lot of us on this call have seen language shift and transform even in the last 5 years, or like Kelly was speaking to post-COVID, the way that we talked about mental health, the way that we talked about loneliness, the way we talked about resources was different even in 2019 versus now after the pandemic, post-pandemic that we're still dealing with right now. The way that we talk about student support, client support has changed. And so Safer Spaces kind of calls upon us to continually evaluate the language that we're using, the words that we're using, the practice that we're putting in place, and saying to our clients, like, is this what you need right now? We know it's what you needed 6 months ago, even a month ago, or 2 years ago, but is it still currently working? And if it's not, how can we continue to make this safe space even safer for you? And so when you think about like best practices, I know it feels a little on the nose for a therapist to say like trauma informed practices what we should be doing. But trauma informed practices are what we should be doing because operating from a trauma informed space ensures that we are recognizing everything that people are bringing into the room with them, adults, students, things of that nature. And a lot of times, trauma informed feels a little bit like a buzzword, but what that actually looks like in practice is what that looks like in practice is one, creating opportunities for questions to ask and for things to be changed, giving people choice for how they operate in an environment. Like, hey, there's 3 or 4 things you could do here. You don't have to do any of them, but here's some options for you. It's creating pathways for folks to share their needs in a way that feels supportive. Then do you want to do it in a group setting? Do you want to do it in a one-on-one setting? Do you want to bring a friend with you? The more elements of choice, the more elements of just comfort that you can put into these spaces will make them more trauma informed. And it also requires us, when we're creating safer spaces, to do a lot of our own work, to continue learning, to come to webinars and like this and learn from other folks, to understand what's happening in the community more robustly so that we're always kind of aware of what's happening, and what's changing and what's developing as time goes on.
Thank you so much, Joseph, for that information and sharing some specifics that we can attend to and address. Specifically, as we think about the work that we're doing with youth and individuals dealing with trauma, which is very relevant and pertinent and salient within our community and society. And so that kind of helps to guide us towards the next question as it relates to this trauma-informed care, or thinking about it from that perspective. Ashlyn, understanding that individuals are working with youth, such as coaches, youth leaders, teachers, and volunteers, and all are well-meaning in the work that they're doing, what would be some of the advice that you would have to share with staff and volunteers to avoid causing harm and to make space for individuals to feel safe and comfortable? And maybe even share with us what seems to be working and some of those things that we might want to avoid.
Yes, that's a great question. Two things with that. The first thing would be to listen. We hear a lot of times from youth that they feel the adults in their lives don't listen to them. That even though those adults may be well meaning, they at times may come in trying to fix things or to give solutions, when really what that youth is looking for is for someone to just listen and bear witness to their experience. So just being able to take the time to listen to what that youth has to say, and letting them lead the conversation, letting them share with you what would be most helpful, having to think of it from the lens of we want to do things with youth and not do things to youth. So we want them to be a part of what the solution looks like. We want them to be able to give us feedback on what's going to best help and serve them. And then the second thing that I would say to that is knowing when to seek support. Um, as the adults, we have to know where our points of intervention start and stop. A lot of these issues that our youth are dealing with are systemic and multi-layered, and it's not likely that one adult is going to be able to address all of the needs that that youth has. So being able to see where you as the adult can step in and meet a need for that youth, but then also looking to see where you can bring in other systems of support to help guide and support that youth as well.
Wonderful. I like the language around wanting to do things with you rather than do things to you, or that collaborative conversation is very important for our youth to know that they're being heard and know that that they and their values are being engaged in the work that we're doing with them. So thank you for that, Ashlyn. That brings us to the next question, Kelly, for you, as it relates to something that Ashlyn shared, points of interventions, where to start and where to stop. And so, if you could share with us a little about how you train your staff to know when the level of support and the expertise that they have that is limited, and it would be time to refer particular youth and or their clients or students to a therapist? And what are some of the critical things that we need to know in order to ensure a warm handoff in that process? If you could share a little bit about that thought, Kelly, we'd love to hear.
Yeah, I feel like this will be a intersection of what Joseph just shared and what Ashlyn just shared a little bit. But I think it's important to know, like both with training our staff and our volunteers, I think the important word there is train. You have to start with that intention in mind. And when you are bringing in a team, whether they are staff or volunteers, there has to be adequate training. And I said previously, like in the space of education, we've learned like we can't just tutor and we can't just teach, but we also have to know that that's where our expertise lies. And so we are engaging with students in an academic setting, and we have to, create those social emotional learning options. We have to provide a safer space for those students, but we also then have to know, like you said, where our limitation stops. And so we do provide trauma informed training to our staff and volunteers. And as part of that, we kind of equip people for tools to help students regulate, but not to solve problems. I think, Ashlyn, you said that too, like not coming at a student with the mentality of, I'm going to fix this student, but more, how can I support, help regulate, move to a safer space in those situations. And so our training is very much focused on the capacity that we think those individuals have, whether that's a staff person or a volunteer, and where we want their kind of intervention to stop. We don't train beyond where their intervention should stop. We kind of look at it as a little bit of a continuum. We have our volunteers who engage with students, we have staff who engage with students, and then we have those mental health providers or community partners that engage with students as well. And I think what's really important is to communicate to each one of those groups of people. Everyone has a role to play, and every role has value. So if your value is at the kind of the lowest level of intervention as it relates to mental health, that's okay. It's still a role to play, and it's still a really important one. So I think, we really focus on making sure our training doesn't go further than what that level of intervention should be. We want our volunteers and staff to be well informed, but we also want to know where that level of expertise ends. And I think, you asked about critical things that need to take place to make that warm handoff when we realize we've kind of exceeded our capacity to intervene. And I think if I boil it down to one word, it's relationship. And it's not just a relationship with the provider you're handing off to. It starts with the relationship with the student you're working with. If that student doesn't trust you, they don't trust the handoff that you're making. You also have to have a strong relationship with a family that's involved, a parent, caregiver, guardian. If they're involved with that student, that relationship also matters in making those referrals. You have to have that relationship with the mental health provider or the other community partner that you're handing off to as well. So I think it's just, we can't wait till that point comes and then try to make a warm handoff. We have to build those relationships all along the way. So as an organization, Bright Lane, we really focus on how do we build those partnerships now so that when our students are ready or need that intervention, we're prepared to make that handoff. And, we base our service model on partnerships. So we're partnering with local schools, we're partnering with homeless shelters. So we start from that framework. We're building partnerships all along the way. And that just continues as we also work to serve the mental health needs of the students we work with.
Wonderful. Thank you so much. I believe we have to know our capacity, our limits, our competencies, our areas of where we do things well. And then I like to say the gift of referral, having that opportunity to be able to refer students out, refer families to organizations. But I think the link there is the relationships, because I can make a referral. However, if I don't have a relationship with the individual, if I don't have a relationship with the organization where we are referring our clients to, our students to, then that warm handoff or that warm transition doesn't always happen, and follow through or follow up may not come into fruition. And so thank you for sharing those critical points and ideas as it relates to how we help this system to work. How do we help connect our students and our youth to the resources that they may need in order to help them with the crisis that they may be dealing with at a point in time, if it's related to school-related issues or mental health concerns or even housing concerns as well. So thank you, Kelly, for engaging in that way. I have another couple of questions, and then as we have space and time, we'll entertain questions from our audience. So for Joseph and for Ashlyn, here's a question that I have for you all. What additional tools and strategies would you say are necessary for staff? And it kind of sounds like we're into this conversation about what we can do for staff and those that mentor and volunteer with youth. When, particularly as we shift from the conversation around mental health to their housing instability or their food insecurity or other socioeconomic issues. So, what strategies would we think we would need or could be in place when dealing with these issues as well?
Ashlyn, do you want to jump in first, and then I'll follow up?
Sure, thank you. So this may be kind of an unconventional way of thinking about this question, but I would say for those staff or volunteers or anyone working with the youth, having to do some self check-ins and self-reflection. This can be very heavy work. There's a lot of different things that our youth are challenged with right now, and that can create an emotional toll. So as the individuals working with those youth, being able to check in with ourselves, determining what self-care practices that we're utilizing, making sure that we're showing up as our best selves, so that we don't run the risk of unintentionally causing harm, as we talked about earlier. So really being able to make sure that we have the things that we need to be able to show up in a way that's helpful versus harmful.
Yeah, definitely echo that. I would say I have two responses. One is more on the same route as Ashlyn. It's like those self check-ins are so important, and also that self care. This is really tough work. This is really heavy work, and work that oftentimes folks like us take home with us. And so, not engaging in those self care just makes that burnout even more likely. And so engaging in those self-care practices to make sure that you are your best self going into those spaces, because the clients that we work with absolutely need us um, to show up for them in ways that sometimes other people have not shown up for them. And so to do so, we have to make sure we're always taking care of ourselves and knowing when we need to bow out and we need to maybe call a friend in or call a coworker and like, hey, I actually can't take up this on today. So being radically honest about your own capacity is super important, and just kind of another strategy to have there. More broadly, I would say some like competency trainings for staff are super helpful. Kelly mentioned trauma informed training for her staff, but working with like IYG does clear competency trainings for organizations, but making sure that your staff is aware of what the current language is and has competency working with folks who are experiencing homelessness, who are in marginalized communities, because what we absolutely do not want to do is, in a helping profession, re-traumatize folks by using the wrong pronouns, the wrong um, race, kind of how they identify with their race, like anything of those natures. We don't want to be a part of the problem that's already existing. We want to be at that safer space, and a part of that is making sure we have ourselves on lock before we're helping others.
I would echo to like along with what Joseph said, like the intersectionality of all of these issues of housing instability, food insecurity, mental health, like that is a lot of information for any one person to hold. But I think a lot of times we think of professional development, especially for staff, as development in the area where we work. So like I develop my staff on education, but we have to be really mindful that these issues intersect so often that the professional development that we offer our staff and our volunteers has to be broader than just the issue that we're focused on. And so making sure that our staff have access to, even if it's just informational, like what are the housing resources in Indianapolis? Where can our students who identify as LGBTQ get support? Where can, like how can we address all of these issues? Because it would be extremely rare to kind of come across a student where only one of these things is the issue. And so we have to start seeing professional development as something outside of just the job description that our staff are tasked with, I think.
Thank you. Thank you, Kelly. Thank you, Joseph. Thank you, Ashlyn, for your comments and your thoughts as we consider these particular critical issues and the ways in which they intersect as it addresses the needs of our youth that might be finding themselves in a crisis situation. One of the final questions that we have, and then we'll entertain questions from our audience as well, for all of you, and I will allow you all to pop in and answer the question in the manner that might be appropriate for you. But what would be some key takeaways that you would want to share with our audience? Maybe reiterating or commenting on some of the things that you shared already, particularly for those that are working within the context of a faith community, of how we can best support this next generation. If we had to identify it as Gen Z or Gen Alpha, however you might want to identify that, what would be some key takeaways, particularly for individuals working within the context of faith communities to best support our youth?
I'm happy to start us off. So I think for me, the first thing that comes to mind is with the lens that you kind of just gave us here is working within folks working within the faith community um, should just kind of hold on to the fact that faith is a really hard topic for many youth, for many people in general, but also just for youth right now. I hear a lot of different conversations around faith, all the way from it's like not a part of my life at all, I don't believe in it, it's all fake, to I'm really deeply involved in it, but I don't know how to do that because I also feel there's like an oppressive structure behind the faith system. And so I hear a lot of conversations around faith and the work that I do every day. And so I think just understanding, I guess the takeaway here is like understanding that this is a really multifaceted, complex conversation with youth that they're having amongst themselves already. And a lot of the youth are coming into these conversations around faith with their own trauma from church or from an elder in their community or their own family or their own parents. Like there's just a lot that is kind of wrapped up into faith. And so being uniquely aware of that um, when you have those conversations is so important. Again, to what I shared earlier, we don't want to be the ones who are re-traumatizing our youth. Of course, things are going to happen on um, not intentionally, or I hope not intentionally, but um, if we can be intentional about how we show up and we can be intentional about the ways that we're talking around faith and how faith is showing up in our day to day, that can help youth feel like, okay, this person sees me and hears me in ways that maybe other people had not before. So yeah, my big takeaway there, I guess, to too long didn't read version is be conscious of the trauma behind faith and how that shows up for folks in their lives.
That's great, Joseph. I love that. And I think just really to piggyback off of that is I think when working with youth, we have to enter with understanding and empathy, not judgment. And that, even as people who work in this space all the time, that can be really hard to do. And so just making sure that our mindset going into any sort of position where we're going to be assisting youth is empathy and understanding, and just try really hard to lead with that. And I think the other thing that's really important, kind of two things. One, expect it to be messy. Like it's not going to be neat. And so I think if you go in with that mindset, it also helps because um, I think that we tend to put pressure on ourselves as the volunteers entering into relationship with these youth to like make progress all the time or make it look good. And I think understanding that just kind of unraveling the mess with them is super beneficial. And so you just should expect that, and just knowing that really being present is what matters. The level of expertise is not as important as just being present, and being present, like Joseph said, in a healthy way that leads with empathy and understanding, but that just being there and showing up consistently for these students especially, to Joseph's point, when people in the faith community could previously have been those that have left them. Knowing that people are showing up is really important.
I would just say don't underestimate the power of relationship. Having to understand that sometimes just being there, just showing up in a way for this youth that maybe other adults have not, how that can be a transformative experience for them. Just understanding that healing takes place in relationships. And if we're looking to show up for youth to help them along the way, the relationship is where that starts. So being willing to put in the work to do the uncomfortable things, the hard things, and to be willing to hear some things that we may not like as adults, and having to be okay with that. To really just give this youth the opportunity to be heard, to be seen, and to be valued. Um, and really just being there for them in a way that maybe others have not. It makes me think of the quote, people don't care how much you know until they know how much you care. So if we as the adults are coming from this lens of we're wanting to show that we care, we're wanting to help, we need to first listen and establish that relationship, and then allow the youth to be a part of what the change looks like moving forward.
I love this conversation, and I love the idea of the collaborative work, that it is not just something that we are doing, quote unquote, without being in touch with the people who we're serving, because it does not matter, what we're doing unless people understand that we care for them. And so by caring for them, they're visible, they're seen, they're engaged, they're involved, and they matter. And so I think that is one of the most critical things that we want to convey to those that are working within the context of faith community, but just in the context of working with our youth, our children, and even some young adults as well. There are a few questions that we have from our audience, and so I will make space for all of you or one of you to be able to answer the question that's coming from Sam as it relates to maybe through the three organizations that we have represented here, how many youth need or do you see needing help? And what is the capacity for the system?
Woo, that's a big question. I don't know. I mean, I feel like, chime in, Joseph and Ashlyn, but I feel like they all need help. I mean, the prevention is just as important as, working through mental health issues with students and academic success with students. And I mean, I don't think we can understate the impact of the pandemic on the mental health of youth. And so, you know, I think all of us would probably agree that our organizations are not meeting the need that's out there. That the need is much greater than what we have the capacity to serve at this point. And, there's a lot that goes into the capacity of the system question. It's the financial resources to grow and expand. It's also the staffing, the ability to hire staff and to recruit volunteers. All of those things matter. So, I mean, those are not numbers for sure, but the need is greater than what the system can handle at this point. And I do think that we need to seriously just, say every youth needs support in some way, even if it's a preventative support. We have to do that too.
I agree, Kelly, with the prevention piece. I think that's where we could see some movement. Is that we're not able to meet the need that's out there right now. I think a lot of times systems are reactive versus proactive. So having to find ways to have various points of intervention versus when things are at the worst, they're at its peak, being able to provide preventative services kind of on the front end to maybe help mitigate some of these things before they become issues. So trying to kind of look at this from a very like holistic perspective of not waiting until people are at the end of their rope and now we can offer them services or now you're eligible for this. Trying to find ways to have multiple points of intervention, and preventative measures are interventions.
I think to that point too, also looking at interventions that address multiple issues, so I just look at, for example, like mental health and academic success, like social emotional learning has been shown to improve outcomes for both of those things. And we have those curriculums, we have those programs, we have those models, like they should be fully implemented for all students, because they have been proven to work. And so there's some things too where we can help the capacity of the system because we know there's things out there that will help support students in multiple facets, that they might be dealing with.
Joseph, would you like to share any information pertaining to this particular question?
I think Ashlyn and Kelly definitely handled that one, so I will defer to them here.
Great. I think that this particular question addresses the statistic around how school counselors have been the individuals that have been filling in the gap as it relates to mental health concerns within the capacity of the schools, and how if we look at preventative measures rather than reactive measures within the context of the school, then some of the issues and concerns can be addressed earlier on. So all students, all children, all youth are in need of some of the preventative measures because all of them will face issues and crises at some point in time. So if we can mitigate and or mediate some of these factors beforehand, it helps with the back end of crisis opportunities. Not to say that there will not be crisis, but it could help mitigate some of them. So I think that's great information for us to know. We have another question from Sam as well, asking us to share a little bit about what we understand to be some of the most common situations that might put our young people or our youth at risk and in need of the various services that your agencies provide.
Yeah, I'm happy to start here. So, speaking about IYG specifically, a lot of our youth end up in need of services. There's a couple of situations that seem most common. One is kind of directly after they decide to come out to their family or they were outed by somebody else, either as queer or trans or anywhere in that kind of umbrella. Um, Sometimes that results in youth actually getting kicked out of their homes and they need rapid rehousing services and food and shelter and all of those things. Other times it's like, I'm not kicked out of my house, but it's unbearable to live there. It is not a safe space for me to be here because I'm constantly getting berated, or my parents and my family members are using the name I no longer use, my dead name. They're misgendering me. Like, sometimes it's not necessarily that they do have somewhere to live, but is that place to live an emotionally safer space for them? That happens a lot with our youth clients, especially the 18 and under who are still living at home or still school age. For our young adult clients, oftentimes situations happen with a job loss of relationship, or things of that nature that create these um, influxes in their system. So now that they don't have this job, they're losing their housing. Um, they don't know where to get their next meal. They don't know how to find housing. And so a lot of these situations usually come down to a change in relationship that happens where some folks will need a crisis intervention. Um, those are the two kind of most common situations that happen with our clientele. But I definitely would love to hear from others.
Ashlyn or Kelly, would you like to share more?
I can go ahead. I think my answer, specific to Bright Lane, but also more broadly, is also that anywhere we see an intersection of multiple issues are the students we see at the highest risk and most need of support. So, I think I mentioned at the very beginning that the student groups who have highest mental health needs are students who are dealing with homelessness, housing insecurity, LGBTQ, English language learners. So whenever we start to see like the multiple intersections of different populations that students can fall into, those are the students where we see like the demonstrated highest need. And so those students are at highest risk most often because their housing situation becomes the most unstable. Their mental health can have the biggest impact on their learning. And so the number of services that need to come around those students to provide adequate support increases. And like we've said, the access to those supports isn't always there for these students either. So, I mean, I think we see it organizationally, but I think in the greater context too, it's just anytime you start to see those, just the different things that can compound or in the way they impact a student, we see the higher risk and the greater need of services for sure.
Thank you so much. So this question from John Thomas asks if we could share a little bit more about the reciprocal relationship between housing instability or stability and individuals' mental health. I think, Joseph, you may have shared a little bit about what that might look like for our youth in the queer community, but I wonder about other individuals as well, and maybe even more elaborating around youth in our queer community.
Yeah, so I think the reciprocal relationship there is it's 100% tied to basic, hierarchy of needs, right? If our basic needs aren't met, our food, our water, our safety, our comfort, if those needs aren't met, mental health is going to take a hit, and a lot of times a really big hit to our well-being. And so that reciprocal relationship that I see is not only just in the queer community, but IYG works with folks in the queer community and outside of the queer community. Um, I would say, especially with our young adults, we have a good mix of folks who are in the community and who are not. But the common thread there is when their housing has become unstable or when there's any sort of housing instability, we also notice that mental health becomes a challenge. And I think this is just a broader conversation for folks experiencing trauma. A lot of times it'll be an event that leads to it, but the environment also exasperates that trauma and makes it even more prevalent. And that's when you start to see some of the mental health challenges start up. And the other piece to that is when folks do have the mental health, challenges, there's not always access to seeing somebody. One of the things that has been helpful around IYG is that all of our services are free of charge for our clientele. And of the clients that I see, more than half of them have said, I am only able to see therapy because it is free here. I've needed therapy for a year, for 2 years, for 3 years, but I couldn't afford it at all. And so not only is there that reciprocal relationship between the housing instability and mental health, then it gets even worse when folks do want to see a provider but cannot due to financial reasons.
Yeah, I think we see that relationship all the way down. Like even if you look at people who are housed, if you own your the prevalence of mental health in home ownership is less than rental. So just as you go down the ladder of like how stable that housing is, we see an increase in the prevalence of mental health. So there's clearly a reciprocal relationship there. And then in addition to that, it's like when you're challenged with housing instability, it contributes to the mental health issue. So there's a high level of anxiety, stress, depression are probably the three most common that can come into play around, when you're under that pressure of housing instability. And then that mental health, like the compounding of that impact on your mental health then affects your ability to maintain the housing. So it really is a cycle when people get into that housing instability. And we see it all the time. Joseph, you see it, Ashlyn, I'm sure too, that when someone gets into the situation where their housing is unstable, it really takes a large amount of support around that person to get them out of that unstable housing situation and into stable housing. And I think we see a lot that in stable housing is when people can really start to address the other issues that are prevalent for them as well.
Great. Thank you. Ashlyn, I just wanted to see if there was any additional comments that you may have wanted to share here as well on this conversation or topic.
Yeah, I would just say having to understand the stress that comes from that. Like when, just as Joseph said and Kelly said, like housing is a basic need. So when we think about all of the other things that we are trying to navigate with life, whether that's school, work, relationships, those are kind of higher up on that hierarchy of needs. And it's hard to get there if the foundation isn't solid. So having to just think about the internal experience that those youth are dealing with and how that may be showing up in their behaviors and their attitudes and their emotions, and how that all makes sense given the context of their experience. So making sure to view the issue through the lens that they're seeing it through versus the lens that we're seeing it through. Oftentimes it's just the lens of they're having problematic behaviors or they're not showing up in the way that we want them to in this situation. So having to take a step back and consider why, like what's the barrier for them to show up in a different way in this space. And a lot of times it's stress. Like when we are in a stressed state, it's hard for us to show up as our best selves.
Thank you. Thank you all so much for engaging in this conversation and sharing your thoughts and your wisdom and your expertise through the work that you're doing, through the various organizations, and even through the clients that you're serving. We have one last question just for you all to be able to share as it relates to how individuals and organizations can help to advocate for youth or bridge some of the gaps as it relates to these two crises that we've shared. This will be our last question, and we'll wrap up for this afternoon.
So I think what comes to mind for me is advocating for youth and bridging the gaps looks like attending conversations like the one we had today and knowing that there's Reach for Youth, there's IYG, there's Brightland Learning, and we are just three of the many nonprofits here in the city that are aimed at helping youth throughout their lifespan. And so I think it's knowing where to send people, having some of those conversations, and then sitting there with the youth and listening to them, listening with intention to understand and not just to be understood, and asking them like, what can I do to help you now? How can I support you? And if the answer is I don't know, that's okay that you don't know. I'm here when you do know, because they're not always going to know what you can do to support them. But if you're hearing somebody, you know, a youth talk about something that's happening, oh, that sounds similar to like what I heard Ashley say Reach for Youth does, or that sounds like maybe they would be a good fit for IYG. Even just offering like, hey, I'd love to connect you to this organization, or have you checked it out? Here's their website. Just being able to point folks in the right direction sometimes is more helpful than you might even recognize.
Yeah, and I would add to that not being afraid to enter the conversations. I think, our youth, and especially our youth that fall into the populations that we work with, they get a bad rap in normal conversation. And so I think there's a lot you can do to advocate and bridge the gap without even having to like step into relationship with a youth. Being present, and we talked earlier specific to faith communities, being present in those conversations and being really armed with knowledge about these groups of students and these groups of youth, and just what they're facing and truly how resilient. I mean, I think all of us would agree we've seen some pretty resilient youth as we've worked with them, and just really being a vocal advocate for them. If you're not comfortable in that, I mean, I can't tell you how many people I talk to that are like, ooh, high school math, I'm not really interested in that. So, it can be a lot to like step into the volunteer space, and be in relationship with students, and knowing your own limits is great. Like that's great. But just knowing that like your voice really matters, as you learn about these particular groups of youth and are comfortable advocating for them in spaces where they're often marginalized, is huge.
I would say being able to utilize the power and the privilege that you have to make changes in the areas that you can. So being able to give the youth a voice, to hear from them what's working, what's not working, and then to let that inform how you approach things, whether that's with your agency, whether it's with conversations, whether it's with your congregation, whether it's a policy, like whatever areas you're able to have an impact on, being able to use the level of power to help drive some change, to be able to bring in some new ideas and start new conversations and develop other options to maybe addressing some of these issues than what we're utilizing currently. I love the quote, we don't need allies, we need accomplices. So having to kind of think about, how can I be an accomplice with the youth in this? It's not enough to just say like, hey, yeah, I'm here for you, but how can I use the influence that I have to really help drive change and make a difference?
Thank you. I like that a whole lot. Thank you so much. Thank you all. Thank you, Ashley from Reach for Youth. Thank you, Joseph from IYG, and then thank you, Kelly, as well from Bright Lane Learning. It has been wonderful to engage in this conversation with you all. We're pertaining to our youth and the crisis that they might find themselves in, providing with resources and things that we need to think about and consider as we are addressing these critical issues in today's time when facing crisis with our youth. I'll turn it back over now to Lindsay as we wrap up and close this conversation on today. To our audience, we say thank you.
Well, I think the panelists and Dr. Robertson did a great job. I don't need to add anything other than the fact that we continue to encourage you to engage with the Faith in Action Project and tune in and join us on November 12th for the Faith in Action Fall event with Dr. Reverend Freddie Haynes, and to learn more about how you can engage and get started on a holistic partnership with schools and supporting youth in a holistic way. So thank you again for your time today and being with us.